They're concerned for their patients.
Manitoba's official opposition today revealing a letter sent from a group of critical care nurses at the Health Sciences Centre to the Premier and Health Minister. It outlines their concern over a new model of care implemented in November. They warn the province they won't be able to sustain the model for much longer.
You just don't have the ability to be where you need to be at every given moment.
The new team-based plan came from a third-party consultant group. It increases the number of critically ill patients each nurse is to look after, from 1 to 1 or 1 to 2 in stable cases, to 1 to 2 or 1 to 3.
I've heard from nurses who retired and they thought, you know what, I'm going to come back and help and get into this new model of care, and are saying to me, I am not doing this.
Respiratory therapists also seeing patient loads double or triple due to the sheer number of hospitalizations, according to their union president.
We consider the stress level, we consider the mental health level, we consider the danger of fatigued workers, and that's what's being ignored a lot right now.
The nurse's letter reads, "We are breaking emotionally and physically as our patients suffer from unsafe situations." Manitoba's chief nursing officer acknowledged the challenge in changing the way they work.
We based it on what other jurisdictions have done, and it is absolutely not our intention to put any professional or patient in an unsafe situation.
The nurses want the province to consult with them as the ones on the front lines. They say critical care nurses are signing up for extra shifts, but are denied due to the new model as they use nurses from other wards with less ICU training.
To me, that's a really big red flag, that you're so committed to this KPMG-based model of care that when the nurses with the highest amount of expertise themselves are volunteering to do the work, you're saying no.
The nurses say they're grateful to their colleagues from other areas, but there is little time for training, something Jackson says should have been done between the first and second waves. Nurses also worry this is a cost-saving endeavor that will continue past the pandemic. They want a commitment that it won't. City News posed the question to the Premier's office, which referred City News to the Health Minister's office. Minister Friesen's office did not respond to the concerns before deadline. In Winnipeg, Stephanie Lasuk, City News.
City News has now received a response from the Minister of Health, who thanks the frontline workers for their dedication. In a statement, he says, quote, "We will continue to support them as we adapt to the ever-evolving pandemic. We will continue to put our confidence in the health system leadership team of doctors and nurses who are working hard every day to put in place the plans that are keeping Manitobans safe."